Nitric oxide synthase in the neurons in different areas of the normal, aged, and Alzheimer's brain. A fascinating report clearly demonstrating that in the hippocampal formation, which is really responsible for the memory loss in Alzheimer's patient, a very profound increase in nitric oxide staining in Alzheimer's patients. When we look at 3-nitrotyrosine, that is a protein, an amino acid rather, which is modified in the presence of nitric oxide in the Alzheimer's patients, comparing the control to the Alzheimer's patient, we see a profound increase in 3-nitrotyrosine in Alzheimer's, again calling our attention to the very important role that nitric oxide plays in this neurodegenerative situation. In multiple sclerosis as well, we see significant elevations of messenger RNA for nitric oxide synthase in the brains of MS patients, specifically around the regions of the white matter plaque. Again, looking at our model, other areas where we can intervene in this, the part of the model demonstrating that protein kinases activate the transcription factors. Well, there are some effects on the protein kinases that we need to know about. The protein kinases are activated and enhanced in the presence of arachidonic acid. So what we're saying then is simply that food choices have an effect on activation of transcription factors. That is to say, food choices have an effect on genetic transcription. The actual expression of genetic material can be modified by our food choices. It's good to know that protein kinase activation can be inhibited by the nutritional supplement N-acetylcysteine. So we then look at these critical brain nutrients. Coenzyme Q10 for its ability to enhance mitochondrial activity as well as its membrane stabilization activity. Alpha-lipoic acid because of its profound ability to recycle other antioxidants, its metal chelating abilities, and its ability to regenerate important glutathione. N-acetylcysteine because of its effect on protein kinase activation and also because of its effect on upregulation of glutathione production. Acetyl L-carnitine because of its profound role in basic mitochondrial activity and membrane stabilization. And phosphatidylserine for its role in mitochondrial membrane stabilization as well. Vitamin E and ginkgo biloba both serve as brain antioxidants and again specifically enhance mitochondrial activity. Brain Sustain, an iNutritionals product, contains therapeutic amounts of all of these important antioxidant and mitochondrial upregulators, including 60 milligrams of coenzyme Q10, alpha-lipoic acid 80 milligrams, 400 milligrams each of N-acetylcysteine and acetyl L-carnitine, 100 milligrams of phosphatidylserine, 400 units of vitamin E, and 60 milligrams of ginkgo biloba. In addition, other critical brain nutrients, including vitamin D, which may in fact be a more potent fat-soluble antioxidant when compared to vitamin E, vitamin C because of its important role in regeneration of glutathione, vitamin B12 because of its important role in the maintenance of myelin, magnesium and folic acid because of their role in reducing brain inflammation, as well as vitamins B6 and niacin because of their role in reducing homocysteine, should be considered as critical brain nutrients. Brain Sustain by iNutritionals contains therapeutic levels of all of these critical brain nutrients. One more important piece of the puzzle that we need to explore, and that is an extract of the periwinkle plant called vinpocetine. This exciting nutritional supplement has been demonstrated in various studies to actually improve brain circulation and oxygenation without actually affecting systemic circulation. Perhaps what is most exciting about vinpocetine is its neuroprotective effects, both in vitro and in vivo, inhibiting the molecular cascades that cause the increased free radical production secondary to the influx of calcium. In a study demonstrating the effectiveness of vinpocetine in evaluating human brains with PET scans, it was shown that the regional or global metabolic rates of glucose with vinpocetine were unaffected, but that glucose transport increased throughout the brain, through the blood-brain barrier, and specifically into areas of the so-called ischemic penumbra, or that area of the brain receiving marginal blood supply. And this is an indication that vinpocetine does, in fact, enhance brain blood supply. This study, published in 1987, demonstrated the effectiveness of vinpocetine in patients with mild to moderate vascular dementia, the second most common cause of dementia in our society. The study demonstrated improvements in memory, learning, and in global measurements of cognitive performance. Specifically, there were significant improvements in aphasia, dysarthria, agnosia, muscle strength, and even in coordination in these individuals suffering from vascular dementia. Therefore, vinpocetine should strongly be considered as an adjunct in nutritional therapy in patients who are suffering from vascular dementia, stroke sequela. Its clinically validated dosage range is between 15 to 45 milligrams per day, and it may cause flushing or GI side effects, but really should be looked upon as a very powerful and an effective therapeutic approach as a nutritional support in patients with vascular disease of the brain. The science that demonstrates that there really is one unifying fundamental flaw in all of the neurodegenerative conditions is really quite profound. But what is really more exciting is the fact that there are now profound interventions that we can use in our clinical practices to upregulate mitochondrial activity and indeed reduce free radical production. We hope you enjoy this videotape. Thank you for joining us.
You have heard Dr. Perlmutter explain the latest thinking about the causes of diminished brain function. He has shared how certain antioxidant interventions have been shown to reduce the aging effects on the brain and actually improve brain function. The specific antioxidants that Dr. Perlmutter discussed are found in the very powerful and unique formulation of Brain Sustain, a nutritional powder that he has used in his clinical practice with great success.